Good evening. This is Catherine Henry, and I want to talk to you tonight about inaccurate COVID-19 data reporting. Many people are upset because they can't go to church, they can't go to work, they can't go to school, they can't have family gatherings or go to doctor's appointments or dentist appointments or mental health providers. On the other side of the situation, you have people really afraid of COVID-19. People afraid they will get COVID-19 or their loved ones will get COVID-19. And then others yet are of the opinion that COVID-19 is so egregious, it's so scary, that people who want to go back to work and back to church and back to school and to be with family and family gatherings again, those people are being seen and called as selfish. So let's take a step back. No matter which side of the issue you're on, you've based your opinions on the information that you've been given. Well, especially in a situation like this, where it affects everyone, shouldn't we at least all have the same information? That's what this is about. We have not all been given the same information. The information has been coming from a wide variety of secondary sources, whether it's coming from our governor in a press conference or the Washington Post in a news article. It's important that we look at the actual source of this data. So to understand that, we're going to talk about a couple of things. In the United States, you can Google U.S. Standard Certificate of Death, because in the United States, when someone passes away, you have to, the medical provider or the funeral director or someone will fill out this certificate of death here. Okay, so it's pretty easy to Google and find it. The parts that we're going to be talking about here today are farther down, about maybe halfway down or so, under cause of death, paragraph 32, part 1 and part 2. Again, if you can't see that from the image I just shared with you, you could easily Google that, and at least for me, the CDC option was the first one that popped up. So that's what we're talking about, is a standard certificate of death. So on the CDC website, by the way, all of the documents that I referenced are either available through just the CDC in general, or the National Center for Health Statistics, or the World Health Organization. All the documents that I referenced, though, every single one of them is a government document, and it is listed and cited fully. The full URL and whatnot is available on the document that I published in a Facebook note today, April 24th. And it will also be available on my website, khenry4mi.com, shortly here. So any of this data that we're looking at here is available for you. I did a lot of screenshots so you could see exactly what I was talking about, but every single URL is fully detailed, so you can go ahead and access this information for yourself, and I encourage you to do that. So the CDC website talks about that under the cause of death classification, mortality statistics are compiled in accordance with the World Health Organization. They have regulations specifying that World Health Organization members need to classify and code causes of death in accordance with the current revision of the International Statistics Classification of Diseases, which is called the ICD. The current version is called ICD-10. The ICD provides basic guidance used in virtually all countries to code and classify causes of death. It also provides the rules used to select single underlying causes of death, and it helps medical providers to report all of that on a single death certificate. The ICD also provides the format for death certificates to be used worldwide, and gives, in fact, regulations on the uses of the classifications in their coding or numbering systems. the CDC goes on to explain that death rates are based on information from death certificates filed in all 50 states and the Districts of Columbia. So, like I said, all death certificates filed in all 50 states and the District of Columbia, that's the information when the CDC, when you go in there and you Google and you figure out what death rates are for certain causes of death, that's where the information is coming from. That's why it's so important that we're understanding how the information is getting recorded onto these certificates of death, and what goes into that classification. The National Center for Health Statistics, NCHS, describes that death certificates are generally completed by funeral directors, attending physicians, medical examiners, or coroners. Causes of death statistics are reported in accordance with the 10th revision of the ICD, so ICD-10. In looking at death statistics, though, it's important to note that the numbers do not account for all deaths estimated for various causes of death, as laboratory confirmation is often needed for various causes of death. So just as an example, for sake of this conversation, let's look at flu-related deaths. As the CDC explains, there are several factors that make it difficult to determine accurate numbers of deaths caused by flu regardless of the actual reporting. The CDC continues by saying that the actual number of estimated flu deaths, for example, for the 2017 and 2018 flu season, they believe to be 79,000, despite the actual recorded numbers to be much lower than that, around about 59,000. Also, the number of pediatric deaths reported to the CDC each year ranges from 37 to as high as 185 over the last 10 years or so. And it's important to note, the CDC says, that the actual number of flu deaths in children is thought to be much higher than what is reported by the states to the CDC, because not all flu deaths in children are detected or reported. The CDC also estimates that the numbers of flu-related deaths, they estimate these deaths using statistical models. These are the exact same kinds of statistical models that have been used to estimate the spread of the COVID-19 virus. So in using these models, they estimate that deaths in children since 2010 range, like I said, from 37, but all the way up to about 1,200 children per year. So again, the highest number they have on record for child-related deaths for the flu is 185 in any given year. But the CDC is actually saying that this modeling says that it's actually about 1,200 children every year that die from the flu. So, and the CDC believes that these estimated numbers of pediatric deaths, as well as how they do this for the general public, that these all provide a much more accurate picture of deaths related to the flu. So annual flu deaths are reported much lower than the number the CDC believes to be an accurate number. Or in other words, the CDC recognizes that when the medical provider is unsure if it's the flu or perhaps the patient's underlying medical conditions that actually caused the death, flu is not recorded as the cause of death. So that's not just with the flu, but that is, for example, that's the way it's typically done. Anything that requires a laboratory confirmed test, for example, to confirm a diagnosis, they indeed wait and make sure that they have a laboratory confirmed diagnosis before labeling that as the true cause of death on the death certificate. However, on March 4th, 2020, there was a document. This is available, again, cited in my document here. March 4th, 2020, Guidance for Certifying COVID-19 Deaths is what it's called. And it says right on here, this is from the NCHS, it's informing medical providers and others who complete these death certificates that, quote, it is important to emphasize that COVID-19 deaths should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death, end quote. Well, that's the opposite of what we just talked about, and why the CDC believes that the flu and other causes of death are actually much higher than what gets reported, because things don't get reported without the proper testing to confirm that cause of death. But here with the COVID-19, they're specifically telling people to complete these certificates of death when they have confirmation, or when it's just merely an assumption that COVID-19 was at play. So according to the CDC, we're purposely underreporting flu deaths to be cautious and not assign something where we don't have accurate information, while simultaneously instructing medical providers to overreport COVID-19 deaths. On March 24th, the National Director of the NCHS issued a new alert informing medical providers of the new ICD code for COVID-19, which is U07.1. So this was called COVID-19 Alert Number 2, dated March 24th, 2020. And it is quite a long document that goes in detail. So in this, the director explains that there is this new code for COVID-19 deaths, and he talks about 7.1. The director continues to say that the World Health Organization has provided a second code, 7.2, for clinical or epidemiological diagnoses of COVID-19 where a laboratory confirmation is inconclusive or not available, but then states that NCHS is not planning to implement 7.2 for mortality statistics. So he comes out and says, although we have to use the forms as indicated by WHO and the format of these death certificates, and we have to do coding for all kinds of deaths according to the ICD-10 standards put out by the World Health Organization that all countries do. And even though they have provided these two distinct causes of death codes, 7.1 for laboratory confirmation ones and 7.2 for just merely presumed or assumed or likely COVID-19 deaths, and they want them kept separate, we here in the United States are going to merge them all into one. We are not going to use code 7.2. All deaths, whether they are tested and confirmed or simply assumed, will be labeled under 7.2. With that being said, every country across the globe is going to be using the 7.1 code for only for laboratory confirmed COVID-19 deaths, using the 7.2 code for any presumed or assumed or likely COVID-19 deaths. So here in the US, we're going to be purposely reporting our cases incorrectly so that our numbers cannot be effectively compared to those of any other country. To put an emphasis on just how much they expect death reporting to be skewed toward COVID-19, the director adds, quote, "The rules for coding and selection of the underlying causes of death are expected to result in COVID-19 being the underlying cause more often than not," end quote. It's not directing them to simply follow the diagnosis to the point of doing laboratory testing to confirm. It is merely saying we expect that you will end up having more COVID-19 related deaths from now on than not COVID-19 deaths. To hammer the point home about how inflating COVID-19 death numbers is far more important than efforts to ensure accurate reporting, this director says, quote, "If the terms reported on the death certificate indicate uncertainty by the actual medical provider, meaning it might be just deemed, quote, a likely cause of death, these terms would be assigned the new 7.1 laboratory confirmed code. It is not likely that NCHS will follow up on these cases, so they are purposely putting in assumed cases or clearly stated uncertain cases in with the laboratory confirmed 7.1 deaths. And they further state that they are not even going to follow up with local state authorities or medical providers to see if laboratory testing was later confirmed or not. Medical providers across the country did not think that this was the best way to handle this, and they shared that with the CDC. So in response to that, and to make sure that it was abundantly clear that, well, the facts and the truth just don't matter, when asked, quote, should COVID-19 be reported on the death certificate only with a confirmed test, end quote, because that is what 7.1 coding requires, this director answered, quote, COVID-19 should be reported on the death certificate for all decedents where the disease caused, or, and in bold he says this, or is assumed to have caused or contributed to death, end quote. So, yeah, he is the one that put those very words in bold, or is assumed to have caused or contributed to death. It's the only cause of death, but there's a directive like this to do that. So you might say that, well, at least this doesn't affect any other kind of reporting. Well, it does. And the director went ahead and spelled it out for us in COVID-19 Alert number 3, which he issued on April 2nd, 2020. I believe I do have that one here right now as well. It's called COVID-19 Alert number 3, dated April 2nd, 2020. It states that provisional counts for COVID-19 deaths will include pneumonia deaths. So he explains further in here that pneumonia deaths are included in the provisional counts because deaths due to COVID-19 may be misclassified as pneumonia deaths in the absence of positive test results. Okay, well, by saying that, he is failing to realize that doctors in these cases have actually diagnosed pneumonia and not diagnosed COVID-19 due to either a negative COVID-19 test result or other medical factors. So he's throwing all that out the window and saying that from that point on, from April 2nd on, we are going to include all pneumonia deaths in with COVID-19 deaths when we give this information to the media, when we report it and when we release it to people. These provisional counts are going to include both causes of death, even though COVID-19 might have nothing to do, well, in these cases, it does have nothing to do with the pneumonia cause of death reported. He also says that they are worried about increases in pneumonia deaths being reported because of COVID-19 related issues. However, we haven't seen this increase in pneumonia deaths. As the information on the CDC website indicates, the CDC estimates that 62,000 people have died this year from the flu alone, yet the CDC reports as of April 23rd, 2020, 59,298 actual deaths have been attributed to the flu or pneumonia. So the estimated number of deaths is still lower than the actual reported number of deaths, even though the official flu season has ended. So we're not seeing these large increases in numbers. Furthermore, the actual reported numbers are still lower than the numbers for pneumonia alone, but also the numbers for flu and pneumonia together are on par with the numbers that we've seen really throughout the last decade, and that information is fully available in this document I published as well. But why is this important? Well, the same National Center for Health Statistics tells us that monitoring and analysis of mortality data allows dissemination of critical information to the public and key stakeholders. One of the most important methods of mortality surveillance is through monitoring causes of death as reported on death certificates. appropriate completion of these death certificates yields accurate and reliable data for use in epidemiologic analyses and public health reporting. They also say that monitoring the emergence of COVID-19 in the U.S. and guiding public health response will also require accurate and timely death reporting. I think we would all agree we have to have accurate and timely information on deaths related to COVID-19. Yet despite this, they say that although testing for COVID-19 should be conducted, it is acceptable to report COVID-19 on a death certificate without this confirmation and to classify it as having had laboratory confirmed scenario. So where does this leave the accuracy of all this COVID-19 data? Well, if you do a simple Google search on your phone or tablet, might show up the same way on a computer too. You would probably get the cdc.gov/coronavirus-interactive/index-html. That website looks like this. And as of the last time this was refreshed about 16 hours or so ago, it was at 46,379 deaths. So, at the exact same time that I was looking at this, I just simply opened another tab and I had dug around, and after extensive digging, you can find additional COVID-19 data, which was data as of the same April 23rd. That data shows that COVID-19 deaths as of the same day are, again, this is comparing to the 46,379 we saw on the other CDC webpage. This CDC webpage shows that as of the same day, COVID-19 deaths are actually only 23,358. So, not sure if you could see when I brought it closer there, but COVID-19 deaths, it says U07.1. That's the ICD code we talked about earlier. And then there's a 1. So if you scroll to the bottom, you can see that deaths, it says number 1, means that deaths with confirmed or presumed COVID-19 are coded to ICD code 7.1, even though they clearly are supposed to be separated into laboratory confirmed is 7.1 and suspected, likely, or assumed cases are supposed to be 7.2. So this number of 23,358 is actually not the COVID-19 laboratory confirmed deaths, as that number alone would be much smaller. But we actually don't have the actual number of what the two categories would be because they are being directed on these certificates of death across every single state to merge the two categories and label them both under 7.1. So, to recap, the CDC states that its mortality statistics are compiled in accordance with the World Health Organization's regulations requiring countries to code causes of death according to the International Statistical Classification of Diseases, which is ICD. This ICD not only provides the codes like 7.1 and 7.2 for classifying deaths, but it also provides the rules for selecting the single underlying cause of death. And indeed, the CDC asserts that that all of its reports represent deaths that are coded according to these ICD guidelines, and that death certificates are filled out according to these ICD codes. An average of 55,000 deaths are reported each year for flu and pneumonia deaths. but the CDC believes that number is far lower than the actual number of deaths, which they say is probably closer to 79,000. So while flu and pneumonia numbers are underreported, and understandably so, the National Center for Health Statistics directs medical providers to include unconfirmed or likely or assumed cases and list them as COVID-19 deaths. The CDC follows all the WHO or World Health Organization rules on reporting death statistics and even prefers doctors use the proper COVID-19 name when filling out the death certificates, yet it purposely reports all WHO ICD code 7.1 laboratory confirmed deaths in the same category, like I said, with assumed, suspected, or likely COVID-19 deaths, which under WHO guidelines should be labeled under 7.2. So this means that not only is our COVID-19 data no longer apples to apples with every other country in the world, we can no longer compare our COVID-19 death data to theirs because they are using the codes 7.1 and 7.2 to distinguish between laboratory confirmed and assumed cases, and we are just lumping them all into one. But in addition to that, this means that our COVID-19 death statistics are now no longer scientifically or medically sound. Instead of focusing on the actual data, the NCHS tells doctors to record COVID-19 as a cause of death, quote, more often than not, end quote. And since that alone does not inflate the COVID-19 numbers enough, pneumonia deaths are purposely added to the provisional counts, i.e. the numbers reported to the media. The rationale for that being that they predicted an over-reporting of pneumonia. However, the total number of pneumonia and flu deaths reported is still less this year than what the CDC estimates would have already happened by April 4th of this year. Not to mention that the total number of pneumonia and flu deaths reported is on par with the numbers we've seen throughout the last decade. So, despite analysis of mortality data allowing dissemination of critical information to the public has been given nothing but misinformation, purposely designed to breed fear, and consequently compliance with entirely unnecessary stay-at-home orders and other infringements upon our fundamental constitutional rights. It's important to look at all of these numbers in context with the other causes of death that we have, more specific comparisons with flu and pneumonia, but also other leading causes of death, because when you just look at one cause of death alone and you hear the numbers of deaths, yes, we don't want anyone to die. And so anytime we hear numbers of someone dying, it sounds terrible, but we do have to look at the rates of those deaths in comparison to other things and realize how our policies are being shaped, and it'll help us determine if those policies are reasonable given the circumstances. Thank you.